Well, every day we are filled with busy schedules such as work, school, meals to prepare and basic household needs. For most of us, it is a challenge. We manage to make time for these things, but for people with ADHD, these daily tasks are even more challenging, especially because people with ADHD have difficulty managing their time. Attention deficit hyperactivity disorder is a brain disorder marked by an ongoing pattern of inattention and/or hyperactivity, impulsivity that interferes with functioning as well as development. Well, to help us understand this condition is child and adolescent psychiatrist Dr. Sarvani Pather joining me in studio. A very good morning to you and thank you so much for joining us on VUCA Africa this morning. Well, just to understand more, can you tell us how do we define ADHD? All of us have heard about it, but how do we define it specifically?
Well, ADHD is a neurodevelopmental disorder. So it's a disorder that has its onset in childhood, and it affects the development of the growing child because the area of the brain that is involved in all of these daily activities is affected by this disorder.
And how can ADHD be identified in people? What are the symptoms or the behavior patterns?
Well, ADHD is attention deficit hyperactivity disorder, and it is exactly what it says. So there are inattention symptoms and there are hyperactivity and or impulsivity symptoms. So the symptoms of inattention would include being very easily distracted, not being able to focus or concentrate for very long, not giving attention to detail, rushing through tasks, making mistakes, forgetting to do certain things. The symptoms of hyperactivity would be being very fidgety and restless, not being able to sit for very long periods of time, being very talkative, and impulsivity is acting before thinking, being interrupting or being very intrusive, not being able to wait your turn. Those are the common symptoms that we see in children with ADHD.
And who can diagnose ADHD? How is it diagnosed as well?
Well, ADHD is a psychiatric condition and is most often diagnosed by either a psychiatrist, namely a child and adolescent psychiatrist like myself, or a pediatrician, because the onset of the illness is often in childhood, and these are the doctors that are involved in the care of children. But the symptoms are often identified within a school or learning environment. An educational psychologist or a clinical psychologist may also be able to make the diagnosis and then refer the child for further care. The diagnosis is made based on information that we receive from the caregivers involved in the child or the teenager's life often. Now, the diagnosis can be made in adults as well, and we need to gather that information from relevant individuals in the child or adult's life, as well as the person who's affected by the disorder. We use rating scales, and we use all of this information to make the correct diagnosis so that we can help the child, teenager, or adult.
Well, how often is ADHD misdiagnosed, or I actually want to say mistaken for something else in children, and then actually it comes out that the child has ADHD?
It is often missed. It is often misdiagnosed. And we have to have a high index of suspicion, and we have to be aware of the presence of this condition in many children. So it's often overlooked, especially if there are other symptoms. There may be other co-occurring conditions, and the ADHD may be missed. But if the child receives the attention they need, then we can diagnose the ADHD and also treat other areas that may be affected.
And for those parents, family and friends with loved ones that are suffering from ADHD, what advice do you have for them?
I think the first step with treating ADHD is to receive a diagnosis. So if you are concerned about your child or yourself having these symptoms, the first step is to seek help. And if the child is at school or if it is an adult, the first port of call is to see a doctor, or if the child is seeing a psychologist, to highlight these concerns. Receiving the diagnosis and receiving the correct medication and treatment is the first step, and that improves the quality of life of the child or the individual who's affected with ADHD.
And how can ADHD be managed? Can it be cured or can't it be cured?
There is no cure for ADHD, but it can be very effectively managed with the use of a combination of medication and, as you've said, being aware of the ADHD symptoms and how it affects one, receiving the correct kind of support in your working or learning environment, and modifying aspects of life to accommodate the ADHD symptoms and the challenges that they pose.
And then looking at people that have ADHD, what other risks do they run of getting other disorders, the mental disorders from this ADHD, or maybe because of the situation that they are in?
The risk is very, very high. ADHD is commonly found to occur with other psychiatric and psychological problems. One of the most common problems that especially children and adolescents have would be learning disorders or a degree of intellectual disability, anxiety symptoms, mood symptoms, sometimes behavioral problems, as well as other medical conditions like epilepsy, seizures, a tic disorder, obsessive compulsive disorder as well.
Well, let's take a look at routines for people with ADHD. It is apparent that it is very important for them to keep a routine and to make sure that they get to all the activities that they need to. How do you go about, let's say, setting up a routine for a person with ADHD or managing their daily lives?
Well, if we're working with children and an adolescent, we would work very closely with the parent of the child, all caregivers involved in the child's life, and we also involve teachers or peers, nannies, aftercare individuals to create a structured environment. So we would recommend having a schedule, and if it's a younger child, using lots of pictures and color to create a structure and a routine that the child or a teenager can later on internalize. If it's an adult as well, we advocate having structure, routine, so that it's easier to get to tasks, to complete tasks, to always be aware of what needs to be done.
Well, thank you so much for joining us in studio and giving us some more information on ADHD. That was adolescent psychiatrist Dr. Sarvani Pather joining us in studio, giving us some more information on what ADHD is and how we can